I want to start with our mission and our vision. If you know anything about our department, you know that we are truly a state agency that's mission and vision driven. And just really quickly, I would point out a few key words within our mission and vision that to me says everything you need to know about our department. The first is creating collaborative pathways. So when I go through the programs that we fund, one of the themes that you'll see this recurring is that the vast majority of the work that we do, that we support, are through community partnerships. We as a state agency have approximately 1,000 grant contracts that we send out annually. So we fund and partner with just a wide array of agencies, including community mental health centers, substance abuse treatment centers, local nonprofits, local governments, faith-based groups. We're very fortunate to have just collaborations across all areas of the state. Resiliency, recovery, and independence, those are our goals. Everything that we do is trying to help Tennesseans become more resilient. For those who are living with a mental illness or substance use disorder, helping them find recovery, and maybe most importantly, providing the resources, services, and supports these individuals need so they can live an independent life in their own community, a fulfilling life. And you can see in our vision, it's all about helping create a state where Tennesseans living with behavioral health conditions not just exist in their community, not just, I guess, persist, but truly thrive. So this is our mission and vision, and I always start any talk that I do with this information. You can see here some of our key values as a state department. Partnership, as I said, is one of those key values. Solutions and outcomes oriented. If you know our Commissioner Marie Williams, you know of probably anybody in state government, she is the most solutions and outcomes oriented leader that I know. We are very blessed to have her leading our department. She also, along with all of our other leadership team members, embody compassionate and effective leadership. One of the things about our department is that so many of us have our own personal experiences with mental illness, substance use disorder, whether that be as an individual or through our family members. This work means something to us within the department. And I think that really culminates in the values that you see here on the screen. I did want to provide some information related to kind of the structure of the department. You can see that we are the licensing authority for behavioral health providers in the state. So we don't license practitioners. Our folks on the Zoom here from the Department of Health would be the ones who take on that responsibility, but we do license over 1,800 behavioral health providers across the state. I mentioned the number of contracts that we have for community-based services. You can see it just eclipses 1,000. One of the things that we do directly, and that is our regional mental health institutes. There are 4 state psychiatric hospitals in Tennessee, one in Memphis called Memphis Mental Health Institute. Bolivar, Tennessee has Western Mental Health Institute. Here in Nashville, Middle Tennessee Mental Health Institute, and down in Chattanooga, Moccasin Bend. You can see the number of inpatient psychiatric beds that we maintain across those 4 state hospitals. We as a State Department, even though our budget continues to grow, and we are thankful for that, and I'll highlight some of the recent budget increases here in a minute, we're a fairly lean and mean department. We have a little over 1,800 staff. I would say approximately 1,600 of those work in our state hospitals. So our central office does not have a very large overhead as far as the number of people working here in downtown Nashville. You can see here in FY23, this is the current fiscal year, our department budget is $548 million. A couple of things I would point out that are important to note is the funding streams for our department. You can see about 70% of it is state funding, 23% federal. But what's really important to note, you can see $515 million of our budget, 94% of it goes to direct services. The majority of it going to community behavioral health programs, community mental health, community substance abuse. We feel really strongly as our mission indicates that people can live in the community with the right services. And we've done a lot of work over the years to build out community capacity to best serve people living with mental illness. So these are just some items I would note for the current fiscal year. These are new dollars that the department received. I will not go through all of these, but a couple that I'll mention. The provider rate increase in Caitlin's department, TenCare, was really helpful in working with our department in creating a document that I think led to a lot of these cost increases. So behavioral health workforce challenges are something that we are facing, and it's a significant issue, not just for us, but across all of healthcare. We were really fortunate this fiscal year to receive close to $18 million to do provider rate increases across all the services that we fund, primarily to address workforce recruitment and retention issues that behavioral health providers face in our state. So these were welcome dollars that were much needed among our provider network. A couple of other things to note, and you'll hear more about this maybe later in the presentation. We as a department do a lot of work around the justice-involved population. So I say this a lot. One of the symptoms of having a severe and persistent mental illness, one of the symptoms of having a chronic substance use disorder is often an interface with law enforcement. So we have, as a department, worked very collaboratively with the judicial system, with local law enforcement to create alternative pathways for individuals who may interface with law enforcement, who've committed a low-level offense, who need treatment, opposed to a bed in our local jail. So this fiscal year, we actually received funding to stand up mental health recovery courts. You may be familiar with recovery courts in our state. There are 82. We are expanding that model to focus on mental health, and that's a really big deal. The third thing I'll mention here is the Creating Jobs initiative. If you've got a good job that pays a livable wage, that provides meaning in your life, that can go so far in helping you achieve recovery if you have mental illness or substance use disorder. We implement a program called Individual Placement and Supported Employment. In this fiscal year, we received $900,000 to basically use as match money for our partners at the Department of Human Services. So they're drawing down a 4-to-1 match, and we're basically doubling the number of IPS supported employment specialists across the state. So in y'all's work, if you come across someone that is wanting to work, that has a mental illness, there are providers across the state that can work with those individuals in helping them find a job of their choosing, a competitive job. And we're seeing a lot of positive outcomes from this program. These are just some other notable things that we've been recently funded to do. I'll talk here in a minute about our crisis continuum, but ultimately we recently received $35 million in American Rescue Plan funds. These are federal funds that came out of the ARP legislation to expand the number of crisis stabilization units, crisis walk-in centers. We'll talk more in depth about that here in a minute, but again, a really important thing to note as far as how to support people who are experiencing a mental health crisis. This is just a graph that shows the increased investments in our department since FY11. You can see there's been a 100% increase in state funding to our department over the past 12 years or so, a $410 million increase in federal grants. I cannot say enough about the team we have here at the department in that they are very, very committed and successful in procuring large federal grants to augment the work that we are funded through state dollars. And again, this speaks for itself as far as the investments that our partners in the state legislature and in the administration have made in behavioral health. This is for next year, so the budget just recently passed. If you pay attention to those type of things, you'll see some redundancy. We are getting another $18 million to support provider rate increases. 2 years ago, we asked for $36 million. We got half this year. We're getting the remaining half next year. This is a big, big deal for the public behavioral health system in the state. Other items, school-based liaisons, I'll talk about that here in a minute, but in the governor's amended budget around school safety. Our department is receiving $8 million to support 114 new school-based behavioral health liaisons that will work across the state. We've got a really great budget going into next year as far as cost increases go. All right, so some key mental health programs. Wendy, I'm sure you're saying, okay, get on with the financial stuff. Let's talk about the programs and the services. So I'm going to jump into some of the things that I hope not only this group knows, but really people across the state. And I'll start with the Tennessee Mental Health Crisis Services Continuum. Folks like me, folks like Caitlin Wright, who you'll hear from in a minute, will tell you that we are really fortunate in the state of Tennessee to have the crisis continuum we have. We're also really fortunate in Tennessee to have a situation where the Medicaid Authority, TennCare, and the State Behavioral Health Authority work incredibly close. You don't see that in every state across the country. But the mental health crisis continuum, you can see from this infographic, basically encompasses people who call for help, people who are responded to, who need help by virtue of mobile crisis services, as well as people who need to go into crisis stabilization units, who need to go to inpatient psychiatric care. You can see, and this is data from FY21. We've got an updated version that's not included in this, but in FY21, there was over 128,000 calls made to the crisis lines here in the state. That's a lot of people reaching out who need help. Many of those individuals are successfully triaged on the phone. So when you call a crisis counselor, many of them are able to be stabilized there on the phone, connected to other community resources. You can see here in FY21, 58% were resolved on the phone. The remaining are referred to what we call mobile crisis. We have a statewide mobile crisis system here in Tennessee that goes to people's locations to determine imminent risk or harm. And if there's not an imminent risk or harm, and there's not an obvious mental illness, they'll help connect those individuals to other community services. You can see in 21, the mobile teams completed over 72,000 face-to-face assessments, of which 63% were diverted from inpatient hospitalization. That's a good thing. It's not to say that there are not people who need inpatient psychiatric care. They do, but we also know that there are community-based resources that can help the majority of people in the state. This is, if you write anything down that I say today, these would be the three numbers I would ask you to write down, and that's 988. So the best way for me to describe 988 is effective as of July 16th last year. This is the front door to the public behavioral health system, 988. 988 used to be the National Suicide Prevention Lifeline. It used to be a 10-digit number that Wendy, people quite frankly had a hard time remembering. Thanks to our partners on the federal level, 988 was created, in part to take some of the demand off 911, but also to create a resource that's easy for people to remember. You can see that since 988 went live last July, our crisis providers who answer these calls, there's been 21,000 calls to 988. It's also a number that you can text with. That's a huge deal for people who may be, a little concerned about talking to someone on the phone. We know with our younger adult population, they're more amenable to texting. So you can text 988. You can also go to 988lifeline.org and actually chat with a trained counselor. Tennessee, as the slide here says, we have 7 call centers. We have statewide coverage. Our department is continuing to support what predates 988, and that's the statewide crisis line, 855 Crisis 1. There's also individual crisis lines from our crisis providers that you'll see here in a minute. But truly, we are doing our best to support and educate people about 988. This is a very important resource for the community. Here you can see the agencies that we partner with for the crisis continuum. And I must say, TennCare is a key partner in that they help fund these services along with our department. You can see here at the bottom, the 12 agencies or so, the 11 agencies that partner with us to do crisis work. There's actually 12, but this doesn't represent Youth Villages, who does our youth mobile crisis work. But if you're over in West Tennessee, you're probably familiar with agencies like Professional Care Services, Alliance Healthcare in Shelby, Pathways Behavioral Health there in the Madison-Jackson County area. Middle Tennessee, agencies like Mental Health Cooperative, Centerstone, and then moving to the east, places like the McNabb Center, Ridgeview Behavioral Health, Frontier Health. These are organizations that have been around, many of which have been around for decades. I think it was the McNabb Center just recently celebrated its 75th year. I could be wrong on that. But these are organizations that are fully embedded in their local communities and have been around a long, long time to provide support. These are the agencies that have the mobile crisis teams. These are also the agencies that fund and support our crisis stabilization units, crisis walk-in centers. So scattered throughout the state, you'll note that we have CSUs that can serve people who need a 4-day, 5-day stay in a CSU bed. So if you're not in crisis, I think the obvious next question is, okay, if someone comes to us and they're in crisis, what do we do to help? And the number one thing to do is to connect with 988. And that of course is beyond just validating the person's concerns, listening and just not giving answers to people who are in psychiatric emergencies. But I think just listening and validating is the most important thing, but also having that person say, or talking to that person to say, look, there is a resource I can connect you with, and I'd like to call 988 with you. That would be my main suggestion to do when it comes to helping people who are experiencing some type of mental health emergency, someone that may show up at your workspace and be in a bad place. I would first probably ask, what can I do to make your life a little easier at the moment? Again, listen and validate, and hopefully work with that person and connect them with someone through 988. But once you get past the crisis and offering the crisis support, what can you do to help support people who need ongoing behavioral health services? This is a really important thing to note about our treatment funded work. Our department serves as the agency that supports uninsured Tennesseans. We are the safety net provider. So if you come across individuals that are uninsured, that have a mental health issue, there's a program for them, and it's called the Behavioral Health Safety Net. You can see on average, we serve about 40,000 Tennesseans through the Behavioral Health Safety Net. The eligibility criteria for the safety net was increased in FY20. We moved it from 100% of federal poverty level to 138%. So essentially, if you don't qualify for Medicaid, if you don't have commercial insurance, you can benefit from this program. You can see the most access services through the Behavioral Health Safety Net. And on our website, Wendy, I think our website is incredibly informative. If people are looking for more information on how to refer people to the safety net, all of that is listed on our website. It's essentially the same agencies that we partner with, the community mental health centers that provide our crisis services. Recently in FY21, we said we need to expand this program to serve kids. Even though there are not nearly as many uninsured kids in the state as there are adults, there's probably 3 to 4% of kids in our state who are uninsured. So now that population can receive community-based mental health services through our department, same type of services as the adult safety net, same providers. Again, here's the link on the slide. If you're interested in learning more information about the safety net, tn.gov/BHSN. Won't spend too much time about our regional mental health institutes because I want to be sensitive to Caitlin's material. But as you can see, and as I mentioned earlier, we operate 4 state hospitals. They primarily serve people who have been involuntarily committed. So they've met criteria, commitment criteria. There have been 2 certificate of needs signed saying that this person needs inpatient involuntary care. You can see the type of care that our hospitals are providing, each of which are Joint Commission accredited. We're doing really good work in the RMHIs across the state. Here are the locations of the regional mental health institutes. I referenced earlier the number of beds. You can see the majority of folks who are coming into our state hospitals are uninsured. I'm sure Caitlin will talk a little bit more about the TennCare population and where they are served. It's not that they don't come to the RMHIs, but there's private psych hospitals that serve people who are covered by TennCare in addition to the RMHIs. You can see the average length of stay. It's about 6.7 days in the Regional Mental Health Institute. So it's a more of acute care environment. Our department is not the primary payer for kids. As I said, most kids in the state have insurance, and that's a great thing. But we do a lot around children and youth to help supplement and enhance what our partners at TennCare are doing, DCS, DOE. I talked about the safety net, the school-based liaisons. This is a really important program because we know if children have mental health issues, the place that they're most likely to receive it, as far as treatment, is in the school. And so we have partnered with agencies across the state to continue to expand our school-based behavioral health liaison program. With the recent $8 million that will be in the budget next year, there will be 250 funded positions across the state. So they're employed by agencies like Centerstone, Mental Health Cooperative, but co-located in identified schools by the local school district. And it's all about addressing barriers to care, providing treatment, providing clinical services to kids in a natural environment, but also providing consultation and support to teachers and staff. If you've talked to any educators lately, they'll tell you that they're seeing more and more children with mental health needs. They need the help, and the liaisons are doing just that. We as a department are also continuing to fund a lot of suicide prevention work, mental health awareness. You can see TSPN is a key partner of our organization, Tennessee Suicide Prevention Network. We also work with organizations like Mental Health America, the Mental Health Association of East Tennessee, Jason Foundation. Would note really quick there on the right, in FY22, the governor did something that's truly unprecedented. He set aside $250 million in a trust fund for our department to begin using the interest to expand mental health services for kids. So this is a big deal, and I anticipate people will hear more and more about this over the upcoming year. Housing is a big deal for us. I'm looking at Caitlin. Caitlin used to work at our department and work in our housing office. She can probably talk more about housing than I can, but you can see our housing really hinges on the Creating Homes initiative. This is something that Commissioner Williams started 23 years ago. And it's all about supporting positions across the state called regional housing facilitators who work with community partners to write grants to create new housing opportunities for people living with mental health issues, co-occurring disorders. You can see in the past 20 years, there have been over 32,000 housing opportunities created through this initiative, almost a billion leveraged since 2000. We've recently expanded this model to include recovery residences for people dealing with addiction, also people re-entering the community from local incarceration. The picture here is an example of a Chief-funded project. This is Cross Bridge here in Nashville. You know, you can see that the Davidson County invested in this project, Amazon, as well as our department. And there's several rooms in this facility that will be set aside for people with mental illness. If you're interested in knowing like where these facilities are, where these housing opportunities are, Wendy, I'm not sure if it's on the resource link, but there's a website called Recovery Within Reach. And all of this information can be found there as far as drilling down by county to see where these housing options are for people with mental illness. That's a really important resource for everybody. Project Rural Recovery. If you're living in some of the more rural, distressed areas of the state, you'll know that accessing behavioral health services, mental health care can be a challenge. We thought, well, let's just take services to them. It may not be reasonable to build out new outpatient clinics, but if we can find a grant and actually provide mobile integrated care to those communities, that could help. And we actually landed a grant right before the start of the pandemic, a SAMHSA grant, that's funding 2 mobile integrated care buses that work in underserved counties in the state. We were recently funded with additional ARPA funding to expand this to 4 buses. You can find more information about where these buses go each day of the week on our website. They'll go to, on the same day of the week, they go to a certain county. They may set up at the local Dollar General parking lot, the local Walmart, the local DHS center. This is all free care that's available in those rural distressed counties. I wish I had the list of counties on this slide, but I know on our website, if you just type in Project Rural Recovery, it breaks them out. I talked about IPS supported employment. I won't talk more about that. I could talk all day about certified peer recovery specialists. I would just note really quickly, we recently hit a milestone. There are over 1,000 people with lived experience with mental illness and or substance use disorders who have been trained as certified peer recovery specialists working across the continuum. You can see the criteria to be certified. You can see the areas that peers are working across the state. They're in our peer support centers, which I didn't get a chance to talk about today, our crisis services, our hospitals. There's really no, I think, more valuable tool than lived experience when you're trying to work with someone with a mental illness. That's what these individuals bring to the table. And we continue to support recovery and lived experience in our continuum. Our faith-based initiative, again, I'm running short on time, but just know that we are working with places of worship, places of faith across the state, basically to help educate those communities about mental illness. The majority of people in our state identify with a faith. Many people attend on a regular basis a house of worship. We know that that's where they go for help. That's where they go to support. Dr. Monty Burks leads this effort. We have recently, we're I think close to 1,000 on the certified recovery congregations too. These are groups who said we want to play a role in helping the state address stigma and helping connect people to resources. We know people come to us, we can play a role. This is really important for everyone to read up on. And there's a growing momentum around how can we bring the faith communities in to helping us address behavioral health challenges. I just talked a lot. Caitlin, I think I left you maybe 20 minutes, so I hope that's enough time. Wendy, I'm happy to answer questions now or wait till after Caitlin's done, however you would like to do that.
It really doesn't matter. How about if we make sure that Caitlin has enough time? And Caitlin, you can take 5 extra if you want, that's fine.
Sounds good. I think mine will be a little bit shorter. But just wanted to start off by really thanking you, Wendy and team, for having this platform. You know, I've really noticed that oftentimes, even within the same institutions, there are programs that are happening that we're not aware of. And so it's just great that you have this platform. And thank you for inviting me to talk a little bit about TenCare, which isn't quite as exciting as Department of Mental Health, but I'm gonna, hopefully you can see my screen, and I'm going to start with the presentation.
It looks great.
Okay, great. Excellent. So TenCare is the state's Medicaid program. We serve, I've got the list of eligible categories here. So we serve, children under 21, women who are pregnant, parents of minor children, SSI recipients, and then individuals who might need, breast or cervical cancer, and then folks who live in nursing facilities or qualify for long-term services and supports. As Matt said, there aren't a lot of children in the state that are uninsured. Actually, about 50% of the state's children are TenCare recipients. For all of these eligibility categories, there are income requirements, and there are different income requirements for those different categories. But we are, one of, I think about 10 states now that has not expanded Medicaid. And so a person does need to fall into one of these federally defined categories in order to be eligible. And so that's where it's great that Department of Mental Health offers such rich services and has, as Matt mentioned, the behavioral health safety net, both for adults and children now, to support people that do not have TennCare, do not have other coverage. One thing I do want to point out when I mentioned long-term services and supports is that for individuals who have traumatic brain injury that presented before age 22 and may have some functional limitations, like at least 3 functional limitations in major life categories, they may be eligible for long-term services and supports through our Employment and Community First Choices program. And I just wanted to point that out. Sometimes people don't recognize or may not be aware that traumatic brain injury before age 22, diagnosed before age 22, would be considered developmental disability along with those functional limitations. So folks can apply for TennCare. I've provided the link to that, and want to just talk a little bit more about some of the improvements that we have. Folks have probably heard about HealthLink. That's Tennessee HealthLink that replaced our case management level 2. And we have almost 90,000 members that are currently receiving those coordination services, which we'll talk about a little bit more. Patient-centered medical homes. So, almost 800,000 members there receiving coordinated services. We have 48 episodes of care. So that's really to help improve quality of care and then also provide incentives to providers. And we've seen a decline in opioid use, thankfully, since 2015. And I'll talk a little bit more about our B-Smart high quality network there. Our budget is $14 billion. So in my office, there's, a portion with the clinical services in terms of mental health, behavioral health services that would fall in there. And then also DCS, you can see that Department of Children's Services. So there is an interagency agreement between TennCare and Department of Children's Services that is around $380 million. That's also sits within my office. It's covers basically targeted case management and the behavioral health placement options for children in custody. So we're really, what I would say, incredibly fortunate in Tennessee, and that we have a fully integrated managed care model. And so what that means is that, at TennCare, Medicaid, we have a contract that is, with our 3 managed care organizations, our health plans, and our health plans, that really sets the standards and the policies for our health plans to then contract with the providers. I think Matt mentioned the Department of Mental Health is contracted with like 1,000 providers. And so we also are contracted for behavioral health services with many of those same providers. So there will be individuals that'll be getting services in certain programs or by certain providers. The payer may be TennCare, or the payer may be, a grant contract through Department of Mental Health, or it could be, behavioral health safety net for the payer. But what is terrific about having managed care, I think, is we're able to, be a little bit more collaborative and innovative in our services. So really the managed care organizations have lots of the details. They're the subject matter experts on a lot of the services. They have many different innovative pilot programs and things that they're trying to help serve their membership as best they can. So we've got Blue Care Tennessee, United Healthcare Community Plan, and AmeriGroup. And so those are our 3 what we say at-risk managed care organizations. And then additionally, we've got DentaQuest, which is our DMB, that's our dental managed care. And I think many of you probably heard that in January, we now started covering full dental benefits for adults, which I thought was really exciting. I mean, especially for individuals that might have mental health conditions, sometimes medications, or just some different, lifestyle has really impacted dentition. And dental care is very expensive and has always been a challenge. And so I, reflect back to like my days as, boots on the ground and thinking about just how desperate some people would be that I would be serving, and how challenging it was to really get dental care for them. So I was really excited to hear about that, and excited that TennCare was able to offer that benefit to all adults. And then Optumar X is our pharmacy. And then TennCare Select is managed by Blue Care. It's the same, same company as Blue Cross Blue Shield, but we're contracted differently with TennCare Select. And so that is not an at-risk health plan, but rather what we call administrative services. And so that TennCare Select really covers special populations, all of our kids that are in DCS custody, and then covers children that are in nursing facilities under age 21, certain members that are out of state that need really specialized care, and we've sought providers out of state for them. And then also some members that are in one of the DIDD waivers, and have opted into Select Community, which is a specialized nurse care management program. So all of those individuals would be in this separate plan, which is not at risk, which is TennCare Select. You probably have all heard that we are going through renewals now. So folks are probably aware that TennCare has not renewed eligibility for individuals since the public health emergency. Several months ago, the renewal of Medicaid recipients was separated from the ending of the public health emergency. And so in April, the federal government required that all Medicaid agencies begin renewals again. So I wanted to share this information about TennCare Connect because any providers or people that, we're supporting that do have TennCare have probably heard that, there is this big renewal process and we will be renewing everyone. So TennCare Connect is our self-service portal. And this is just some screenshots of like what this looks like. So you can go to TennCare Connect online, or you can download the app on your smartphone, and you can help a member, establish their own account, and they can update their addresses. They can look in that portal and they would be able to see their eligibility notices, and they would also be able to see the date when they would renew. So not everyone is renewing, in April. It's spread out over a 12-month period. And so, we already know, like Caitlin Wright is going to renew in, March of next year or February of next year. And so you'd be able to look that up and know when to expect that information. But what we always say is that what's most important is that TennCare have the updated address for our members. Oftentimes, notices will get returned, or they just don't make it to the recipient because we have incorrect addresses. So that is a great place to update addresses. I do want to mention that for folks with SSI, they will be automatically renewed. There won't be any renewal packet for them to complete. So I think that that's just important to know. But anyone that does get any kind of Social Security benefits, whether it be SSI, SSDI, retirement income, it is important to note that those addresses do have to be updated with the Social Security Administration because those feed to us. And so that is the source of truth, so to speak, for those. But we're really excited. We were able to get, several things to make things a little bit easier for folks this time. We're doing what we call the ex parte process, where we're relying on some records from like TANF or supplemental nutrition assistance program to help, renew folks. And if they do need to complete packets, the packets will already be like pre-populated with all the information that we have for individuals. So I think I showed on a previous slide that we're at about 1.7 million members right now. That's continuously grown over the last 3 years because we haven't renewed folks. And so we do expect through this process that, there will be some people that will lose eligibility. Matt talked a lot about the behavioral health services, and we have many of the same behavioral health services that are funded by TennCare. So we do have hospitals that we contract with, both for children and youth and for adults. And those are spread out, throughout the state. We have in our contract with the managed care organizations network standards. And so there's standard for inpatient care that, hospital psychiatric inpatient must be available within 90 miles and must be available to members. Crisis stabilization, which is, as Matt said, we're so fortunate in this state to have the crisis system that we do have in place. And he showed a map of those services. So for TennCare recipients, our managed care organizations contract for those services as well, and is one of the payers that help stand up those programs. We've got partial hospitalization and intensive outpatient programs. That's both for mental health and for substance use disorders. ABA is something that sometimes is a service that's appropriate for people with TBI. And there are some clinic-based models and also in-home supports for that. But the managed care organizations are all contracted with ABA providers. And then, of course, the outpatient services like medication management and psychotherapy. And we, rely heavily as part of our network, all of the community mental health centers throughout the state for those services. And then there's also some smaller practices that the MCOs contract with for those services as well. Continuous treatment team, and that should be comprehensive child and family treatment. Those are coordination services. So really boots on the ground in the home, connecting the person with a full interdisciplinary team to coordinate their care. And then we've got also peer support, supported housing, which Matt spoke about. We have 3 levels of supported housing for adults. So we've got the regular level, we have enhanced supportive housing, and then we have medically fragile supported housing. And then we have residential treatment centers or facilities. Typically, those are for 18 and younger. And those are throughout the state. There are some that serve individuals, more specific for individuals with intellectual or developmental disabilities. And then we've got our full continuum of substance use disorder services as well. So just a little bit more about Tennessee HealthLink. So I mentioned that, that replaced our level 2 case management service. They work often in concert with the patient-centered medical homes, really aimed at coordinating care to improve outcomes. And ensuring that people gain a level of independence and access to medical care, essentially. And all of our community mental health centers, for the most part, I believe we've got 18 THL providers, which is majority of our community mental health centers, and then a couple of other providers as well. And then I also just wanted to mention our BSmart network. And so opioid use disorder, as we know, is problematic for our state. I mean, it really runs the gamut across all different populations. And something that we wanted to address at TennCare was really to have a high quality network of providers. So that is through our buprenorphine and enhanced medication-assisted recovery and treatment program. And there's a link there to find out more about that, the MCO contacts for that. And many of those providers, we've got a great network. There's great, terrific services there. Did just want to mention that many of those same providers are also contracted with Department of Mental Health. So, just kind of important as we're thinking about renewals and potential for people to lose eligibility, that we want to make sure that folks, maintain their services and that they, understand that there are other payers available if they do lose TennCare, such as Department of Mental Health services.